Okay. Good morning, Richie, and welcome everybody to our Thursday Facebook Live session. I'm thrilled to have Richie Splitt, Norman Regional Health Systems Administrator, with me this morning. As you all know, we've had some great conversations recently with other community partners. Yesterday, we chatted with a small business, but today we are going to talk with Richie about the great work that our healers at the hospital are doing. They're certainly on the front lines of the pandemic that we find ourselves in. And I'm anxious to hear from him and also to hear what we as a community can do to support the hospital and the folks that are there trying to help each of us out. So Richie, good morning and thank you for joining us today. Appreciate it.
Good morning, Scott. I'm happy to be here and happy to share this information with our great community and all the viewers out there today. So thanks for having me.
Well, to begin with, why don't you share with us what the transition has been like, and when did the transition, from what your normal activities were at the hospital and day-to-day operations, when did it transition over into kind of where you're at today, and how did that all happen and occur?
So for us, a more official start to this was the Ides of March. It was really the line in the sand was March 16th or so. And that's when we began to really implement our disaster planning. We stood up our incident command center and began daily meetings, twice daily, and really planning for the oncoming or the incoming patients that we thought would be COVID-19 positive. That transition was, it was easy for us because we have meetings that we do every day. They're called patient safety huddles, and we just use that time in our patient safety huddles to come together with a group that we call the Emerging Infectious Disease Team. And we monitored how patients were coming into our system. We monitored what was happening in the broader picture related to COVID-19, and we just began to implement our planning and our strategy and tactics in order to care for our patients and to move them efficiently into and out of our health system, and it worked remarkably well.
So that's been about a month now, and as you just said, you had great plans in place, but I assume there's been some impacts around the services you typically provide, like those surgeries that are optional. If I was looking to do things that wasn't life-threatening at the time, all those were put on hold. Is that correct?
That is correct. Actually, Norman Regional was ahead of the curve. We took a leadership stance in that regard. Our physicians and providers, we met together and asked, what's the best thing to do for our patients? And so before the governor came out with his executive order on or against elective surgeries, we already had in place processes to limit those surgeries. And so we really moved from any sort of total access to surgery. We moved toward a really urgent and emergent surgeries only. And there were two reasons for that. The first reason was we believed the right thing to do for the patient, not knowing how this coronavirus was going to come into our health system and into our clinics. We thought it was better to be safe first. And then the other part of that was to conserve personal protective equipment, which is PPE. And so we use a lot of those supplies during surgical cases. And so we felt it was really important that we conserve that for what would be a potential influx of COVID-19 patients. You might be interested to know, a side note is during a normal month, we use around 1 million pieces of PPE in a normal month. And we had to go into a conservative strategy around the use of PPE because we knew it was going to be much more than our usual utilization rate. The burn rate on PPE for coronavirus and COVID-19 patients is significant.
So the Chamber was very proud to partner with the Hospital Foundation and also Cleveland County to establish a drop-off site for individuals and businesses who have PPE and were willing to donate it. And I know that's still ongoing, but talk to us about the need. And with this being a global pandemic, I know every health system was challenged with their normal, their normal ways that they purchase these items. But where are we at today in that regard locally?
So our PPE status is improved. We're in a better position, and we're getting a little better access through suppliers for those various supplies, but we're still not where we want to be. We're more comfortable, but still not at what we would call a normal operating procedure for PPE. So donations are still welcomed and appreciated. And yes, the partnership with the Chamber and with Cleveland County, businesses all around our community, and the outpouring of support was tremendous. And I just have to make a note of that for all of our viewers. And that is that that demonstrates that we have a caring and connected community, and our efforts coming together to do this was remarkable. And we very much appreciate those donations that we have received in the past and we continue to receive. So very important part of us being able to do what we do for our patients, and every one of our healers is grateful for those donations. So thank you for your leadership and the others in our community that made that possible.
Well, I
So
remind people that if they still want to contribute to the cause, that availability is on Monday, Wednesday, and Friday from 3 to 5 at Cleveland County Fairgrounds. And if by chance you don't have PPE, sitting around your home or your business, the hospital foundation is collecting financial donations. You can designate to the COVID-19 crisis, and those funds will go directly to the purchase of PPE. So you don't have to worry about going out and searching for it. You can contribute financially, and then the hospital will be able to purchase the exact items that they need, which I think is a great option and resource for those that are looking to help out.
That's a great point, and I should point out that I believe it was Hitachi and Flintco both made physical donations of supplies that we needed, and then financial contributions so that we could go out when we can find those supplies to purchase them for the hospital as well. So that's just two of many that have been just great in their response, whether that's through food, gowns, hand-sewn masks, N95 masks, KN95 masks. It just goes on and on and on. And we very, very much appreciate that.
What does it look like for the hospital in regards to the national stockpile of PPE? Have you been able to benefit from that?
We've received some benefit from the national stockpile, and we'd like to see more, and that access to those supplies is getting better. And what's happened is through this pandemic, we've all gone through our normal supply channels, and we've had to go beyond that. New and unknown providers or vendors that we are trying to partner with to find supplies. Everybody across the country is doing the same thing. So there's a lot of competition for those supplies. And the national stockpile has been very helpful in helping ease some of that pressure. But we still would like to have more availability or more access to those supplies. It would make us feel much more comfortable and allow us to do our jobs a little more easily. So it's getting better. Every day it's better. So hopefully tomorrow's better than today, and so on down the line.
Sure. Now remind the viewers about your service area, because we think about Norman Regional Health System, and here we are at the Norman Chamber of Commerce. We kind of think about Norman, but you serve a very large population. Is that correct?
We do. We're truly Norman Regional Health System. And so if you want to think about our boundaries, it's up to around I-40 to all the way down to the Red River. So along I-35, 50 miles either side of I-35 going up and down, and parts much broader just immediately around the Norman vicinity in Cleveland County. So it is a broad reach, and we're grateful to be able to provide care to our patients. And really, they do believe and think of us as the gateway to better health. And we don't take that position lightly, and we're very grateful for their support of the health system and our ability to provide that care.
So what's the best advice you give to somebody right now if they are experiencing symptoms? Um, where are you directing them to go to for treatment and care?
Well, we still want them to connect with their primary care physician. That's the best place, the best starting point. And so our communities responded extremely well. So if you don't have a primary care physician, we can help you to find one. And if you don't want to have a specific primary care physician, we can connect you through a virtual app and get you connected to those physicians. But that's the best place, is having a long-term relationship with a family medicine physician who's going to be your health coach, who's going to help you anticipate needs, manage your current condition or potential long-term chronic conditions as well. So we really want to encourage people to connect first with a primary care provider, and they can do that through 515-1000. They can call that number, 515-1000. We can help find the primary care or the virtual app and connect them that way as well. We also have, our ERs are still open. It's not the best use of that facility or that service to get a checkup for symptoms related to COVID-19. But we're still open. We're fully open as a hospital and health system, and we're not quite back to normal, obviously, but we want to connect you first to a primary care physician and get some advice and coaching from that perspective.
Well, you've been talking about your virtual app for a long time now. This isn't, just in direct response to the pandemic that we're in. You guys were on the cutting edge of that a while back, and I mean, what great timing now when people are at home but still want to see a physician or get some healthcare advice, and maybe direct people to how they might access that app and how it works.
Sure. I'm an Apple user, so you go to the App Store and you just search Norman Regional Virtual Care and the app pops up. It's a quick and easy download. The hardest part of getting connected to a provider through the app is inputting your personal information. Beyond that, it's very convenient. And if you have an existing relationship with a physician, we have seen since the Ides of March, when this all started, we've had more than 4,000 virtual visits with our providers, which is a significant increase. And it's been a very effective tool. It allows our providers, our physicians, to stay connected with our patients, and our patients stay connected to the health system. It's just been a remarkable tool, quite easy to use. So go to the App Store on an Android or an Apple device, download Norman Regional Virtual Care, input your personal information, and that's the hardest part. And then you can find a physician there. And there's wait times. You can see what schools they went to, what their background is. It's really fast and really convenient.
Excellent. Well, I would encourage everybody to do that. I've downloaded the app myself months ago, and so I would encourage people to do that and take advantage of that great opportunity that technology provides for us. Now, we've had a question on our chat here on Facebook, and it's dealing specifically with elective procedures. This individual was notified recently that her surgery has been slated for the end of the month. And so she's excited about that, but still a little uneasy just due to where we are in the middle of the crisis. She was curious about, she assumes that means it's safe to have it done. Do you have any suggestions for being a patient and remaining safe as more elective surgeries come online?
Sure. A number of thoughts come to mind about that process, but they will be led to the next steps before the procedure is performed. And so the physician's office will connect with them and tell them step by step what they would like them to do. That will likely include testing. And so that's one of the things that we would like to, as we have more tests available, we would like to do more frequently, is test before the procedure. We'll follow, again, all of those universal precautions where we protect the patients and ourselves and prevent that spread. So the testing will be helpful. Self-quarantining, hand washing, all of that stuff leading up to the procedure, so that, and self-monitoring as well, so that you're confident when you come in that I'm not just, demonstrating any of the symptoms of the coronavirus. I've had the test, everything's good there. We'll be exceedingly clean, as we always are inside the hospital, ready to welcome back our surgical patients from that perspective. So we'll do everything on our part, including the use of germ zapping robots that you've heard about and probably remember from many years in the past, the use over the years in the schools, in our hospitals, everywhere that we can. So we'll be ready, we'll be cleaned, and we hope to provide you that confidence coming in that everything is as good as can be, and we'll take very good care of each and every one of our patients.
So like any other pre-op procedure, patients will be getting those directions, and I'm sure there'll probably be an extra sheet of directions that go along with it to accommodate, where we find ourselves today.
Right, that's true.
Good. So earlier this week, I visited with Sean Bauman at Emmy. They're doing incredible things, and they mentioned the partnership with the hospital. Can you talk to us maybe about that, but in a larger sense, the Chamber is having discussions with its members about what's the right time to quote unquote reopen the economy, and how can we do that safely? So how's the hospital factoring into that, and how are you contributing to that process? Because we certainly, as the business community, which the hospital part of, and you're one of our largest employers, I know you share the same care and concern that we do. We don't want to be foolhardy, but we also care about the economy and jobs and those kinds of things. So talk to us about that.
Yeah, I think what Emmy is doing is remarkable, and it's innovative, and our partnership is a representation of that innovation as well. How can we work together for the improvement of the health of the communities that we both live in, work in, and serve? And so it's been a great partnership, and thanks to the Chamber and keep bringing us together, being a part of that glue that keeps us together and thinking innovatively. They are working on not only a COVID test that they can perform, but a serum test, a serology test that allows us to test for antibodies. And what I've been with Sean Bauman been calling this, and just this morning, in fact, is really a stamp of COVID confidence. So it's a test in time, in one place in time, but in testing for those antibodies, we can determine you have the antibodies from the coronavirus, or you do not. If you're symptomatic or you're not, we can now make informed decisions about going for that elective procedure, going back to work. But it's a confidence measure, and it is a back to work tool, I think, that could be very effective. So we're working through some details about how we can spread that across our community, and maybe establish Norman as a real microcosm of success because of this innovation this tool that we hope to implement that would allow us again to have that COVID confidence to go back to work and resume a sense of normalcy in our community. Our mayor's leadership in that regard has been extremely important. I think the nod from the governor around those opening elective procedures on April 24th is another nod of confidence. And I want to share with our viewers that they may be surprised to know we do not have a hospital filled with COVID patients. In fact, most of the time, most days, we have single-digit positive COVID patients in our hospital. We have 50% less volume, less patients in our facilities, but very few of them, a fraction of them, are COVID positive. So again, we're not New York City, and I think our community needs to know that is we are caring for each and every patient that comes in, and just a small fraction are COVID positive.
Well, I love this, how we have a hospital system and then a private business that are able to work together and both be very nimble in pivoting and transitioning as needed to address the concerns we have, but then be, besides of just addressing the symptoms that are in front of us, you guys are working together to address how we can move forward and what's the next phase of where we find ourselves. And so the sooner that we can maybe get that well, maybe not all clear, but at least a good signal that we can get back to work. I mean, what a great thing that would be. And so we're anxious for that partnership to continue to grow, and we want to be part of that. So thank you for working with Sean and his team and Emmy. I think that's awesome.
Yeah, your point about being nimble and this innovation is a representation of that. Is that two organizations who can act quickly and who can together make a significant difference. And who knows, from this point, as we implement the plan, develop and implement that plan, we could be that national model for getting back to normal, going back to work. And again, it's through that COVID confidence that I'm calling it, that could really take over our nation and help us to resume some sense of normalcy.
So has the crisis delayed any of the Inspire Health plans, or are we still on track to see those innovations come to bear in the coming months and years?
We are still moving forward with Inspire Health, with the caveat that we're not sure the impact of COVID-19 on not only our plans, because we've certainly experienced a significant financial impact from these changes. And so we're moving ahead with our planning, and we have that ability with some flexibility built into our planning cycle. We have the ability to continue those conversations and have plans submitted to the planning committee for our east side property that we all are familiar with, the freestanding emergency department out there. So we're moving ahead as if things will be normal, knowing that things are not normal at this point. So we're optimistic. We're planning for the continued advancement of Inspire Health as we go along. We're not sure if that timing or its impact will affect timing at all, or significantly, or minimally. So we're just measuring that each day and trying to learn more about the actual impact of COVID-19, and not only on the health system, but on construction projects around the country and how that might influence our particular project as well.
Sure. Well, we hope that you're able to move forward in a timely fashion, and certainly the construction will be a nice help to our local economy. I mean, that'll be great as all of your projects move forward. That'd be fantastic.
Yeah, I might add that we have the master plan is being submitted for the freestanding emergency department. We're continuing the conversations around behavioral health, and then the HealthPlex campus. We have two options that we're looking at for that final design. So general master planning, and two options that we are considering for that final project, if you will. And so we, again, just to reiterate and underscore that we are still advancing the conversation and planning around Inspire Health, and we're still very excited and optimistic about it.
Fantastic. Well, as we kind of wrap up our conversation, is there anything else you'd like to share with our viewers and the community at large?
I just go back to the point I made earlier, a caring and connected community. Norman has responded exceedingly well to the needs of our health system, to the healers inside our health system, and to the patients and to your neighbors overall. We've done made a significant difference in the way that we relate to one another, that we care for one another, again, staying connected. That's truly felt on our end as the healers of the Norman Regional Health System. The Friday night lights, where people are pulling into the parking lot and showing their solidarity and support for our healers, it's moving, it's heartwarming, it's impressive. The donations, the kind notes that we receive, the pictures, the sidewalk chalk, all of those things are just wonderful representations of a wonderful community. And I hope this is not just in the time of need and crisis, but this continues on. It becomes more pervasive. That's the infection, that's the spread that I want to see more of, and that together we're stronger. And we've certainly experienced that. So I want to say a heartfelt thanks to all of our community who's been so supportive, so helpful. I could not be more proud of our courageous men and women, the healers who come to work each and every day and do their jobs. They are at the tip of the spear in this battle, and they have done that exceedingly well. And I could not be more proud. I'm so proud to be a part of their team. And the togetherness that's inside Norman Regional has definitely broadened to being togetherness of our entire community. So again, a great deal of thanks and gratitude for all of our support, all of the support that's come to the health system.
I think that's a great point to end on. Together we're stronger. And please extend our heartfelt appreciation to your entire team. And we know that there's a myriad of people who are working to keep our community healthy, well, and safe. And the people in Norman Regional Health Systems, like you said, they're on the front lines of dealing with this crisis. And we can't say thank you enough. So on behalf of our business community and the community as a whole, thank you very much. And please extend our appreciation to your entire crew. Richie, thanks so much for joining us today. We greatly appreciate it. Again, everybody that tuned in right now, thank you for being online with us. Continue to lift up our health system during this time of crisis. They're doing everything they can to take care of us, and so we want to repay the favor. Thanks again, Richie, and we hope to see you real soon.
Thank you, Scott. Thanks for your leadership.
Thank you.